So, hello everybody, and welcome to this evening's performance, broadcast, whatever you want to call it. Thank you all very much for giving up some time to come and tune in to listen to us tonight. I'm Claire Freeman. I'm a consultant pediatric surgeon, and I'm here tonight with my friend and colleague Nicola Burt. And before we start going any further, I want to let you all know that we're going to ask you some questions. We're going to listen to your responses, and that's going to feed into what we're talking about this evening as well. And it's all very informal. If you've got any questions, please put them up on the chat, and it would be great to have some engagement from anybody who's listening as well. So before we go any further, this is my first question to all of you who are listening. So the first question is, have you or anyone you know had foot surgery? So I'm hoping that there will be a yes/no question coming up on your screen, so you can click the appropriate buttons, and we'll come back to that in a moment. So on with the questions that we want to talk about tonight, Nicola. So I know that you're partway through your training at the moment. And you've obviously come a long way from when you first started to think about podiatry as a career. So really what I'm interested to know is where you are now. If you could go back in time and you could have a chat with yourself as an undergraduate, you know, using that wonderful spectrogram, what would you advise yourself?
Good question. There is so much. I think, in brutal honesty, it is literally the power of networking, moving around, getting the work experience, and actually the CPD. And I kind of think you don't really value that as much as what I do now. You were actually, I don't know if you remember or not, you and Mr. Chris were actually the first podiatric surgery unit that I ever spent time in. So thank you so much for that as well, by the way.
Bless you.
Still following down the path.
Where were you studying your undergraduate studies?
So it was actually in University of Southampton. So there,
and I think you were a second year, weren't you? Were you in second year when you came to visit us?
Yeah, I think I was actually the first. I can't remember whether I was in the first year or not, because I tried to get experience before, but I was too young. And then I managed to get into uni, should we say? And then ended up emailing pod surgeons again. So there was you guys, and there was some other people down in sort of nearing Brighton, where I'm from as well, and you guys were the first ones to give me a chance. And so I stepped into theatre then and just absolutely loved it, like really, really did. So if there's one thing as well, so talk about Southampton, because we had different placements around different areas anyway, from anything from Sheffield to the Isle of Wight and wherever, but in between all of that, I remember coming to you guys self-organized as well, and only because I wanted to. But if I was to talk to myself back then, or I guess anyone else that was wanting to go down the surgical pathway, would definitely be to self-organize them work experiences, because it's only now really, when the further on that you go and the more that you look back, you really see the value in things that I guess you guys would do then, even like journal clubs and stuff. Then I was just like completely overwhelmed, like, oh my goodness, like what is this? This is so in depth, and I don't understand half the terminology that you're saying. And I still think about it to this day, because I used to write reflective logs, and I'd still look back at that actually and think, I remember that. Yeah, actually, I can think about that in detail now, whereas I couldn't then. And there is always that.
So
thing.
What I'm hearing from you is that as an undergraduate, you felt quite overwhelmed by everything.
Absolutely. Yeah.
You still made that effort to go out there and to network and ask some questions, and then you've actually used that to promote your career in the future, haven't you?
Yeah.
Yeah. Okay. Good one. That retrospectrogram really works, doesn't it? Yeah. Okay.
Networking, the power of network.
So I'm going to ask out to the audience again. This is another question coming up for you, and I'm hoping it will come up on your screen so that you can do a yes or no click on it. So, have you met a podiatric surgeon? That's your question. So back to you, Nicola. we always like to swap stories about, you know, what's happened to us in clinic, and you know, patients who have not behaved in the way that we expect them to, or you know, things which take us by surprise, because that's always
all
great,
just so
isn't
compliant.
it? So what I'd like to know is, what do you think is the most bizarre thing which has happened to you in your clinic? But, you know, bearing in mind there might be children listening, or there might be grandparents listening.
Okay, nothing gory then.
Yeah.
Oh, you know what? In fact, it's probably going to be something semi-recent, maybe the last sort of couple of years or so, the most bizarre thing. And actually, I have to thank diabetic foot units for this, because they honestly give one of the best experiences, or working experiences, purely for the range of things, bizarre things that you'll see. And I actually managed to... thankfully actually managed to spend some time in a diabetic foot MDT, and to see the way that different surgeons in different spheres actually work. So for example, one of the bizarre things I saw was a post tripod surgery, so they say, from plastics, where they treat surgically a diabetic foot, and they manage it in such a different way to the way that I've ever seen podiatric surgeons operate. And it was probably one of the only times actually that, from where I am now as well, made me clinically think, what would I have done in that situation? And I know that I'm definitely nowhere near as experienced as, you know, your consultants, registrars yet, but it really made me step back and think, whoa, I actually have this foot in front of me that has undergone so much. Did they really need that? Would I have done that? It made me think, as to you guys, what would you have done? So yeah, the bizarre thing was probably that tripod surgery.
So that's a great thing to do, is to always kind of look at something critically, and I don't mean a negative critical view on things, and certainly it wouldn't be appropriate to voice that, but to look at things and say, what, where, why, when would I have done it that way? Could I have done it better? Because actually that's something which is really important in podiatric surgery, is to always review your own work, and to be honest about how you could have done it differently, or how you could have done it better. And that's all part of the sort of reflection, isn't it? And that's so important in any sort of professional role. And you know, the higher risk patient that you're operating on or working with, the more important it becomes, I guess. So some really good reflections that you've done there from your bizarre episode. So we're going to move on to the next question to the audience. So again, we're going to put the question up, and there'll be a yes and no click for you. So, do you think that podiatric surgery is beneficial? And while you're thinking about whether that is beneficial, I'm going to ask you your next question, Nicola. So, what do you feel is the steepest challenge that you've had to overcome? And I know this is a really difficult question, because we're not good at talking about things which are difficult or a problem, because a lot of people will see that as a weakness. Oh, you can't do anything, or you struggle with this. But actually, it's really important that you are honest with yourself, because it's only when you do that that you can work out where you need to work harder or to investigate something more. So what do you think about your steepest challenge?
Was, you know what, it was actually to perhaps, and I say this by means of better words, accept failure and accept time, that, and also to try and balance things as well. Now, because I remember when I was doing my MSc and I was trying to, you know, balance, and I think a lot of people do anyway, you balance your relationships, balance your MSc, seeing family, seeing friends, trying to have a social life, trying to sleep, trying to eat as well, and work at the same time. And the steepest challenge to overcome was to, in amongst all of that, trying to balance everything, keep a sane mind, and also accept that not everything will go smoothly. You know, sometimes you will fail, and you know, the only person really that we have to blame is ourselves, because you know, it really is a case of, did I understand it? Did I learn from it? you know, what do I need to take from what I've just done so that I can improve on myself? And, you know, there is an element of looking to who's taught you to, you know, for the support and stuff, but the support will always be there, not just from your teachers, but from anyone really. So there comes a point when you kind of think, actually, I've got to take control of what I'm learning and really start making adjustments in my life to make my career work, you know. So I think actually that was the steepest challenge, to make everything work and accept the failures and the other challenges along the way. Yeah.
It seems to me that what you're talking about here, Nicola, is building resilience. Building a way of managing things in a really positive way, so you get the best out of all the strands of your life, because it's not just, you know, your life is not just your work, is it? And I think you've made that point very eloquently, that that you need to have that balance in there, but you need to build resilience so that you know how to manage things when you realize that they're a problem as well.
Yeah.
Okay. So I'm going to lead the audience into another question as well. So this is question number 4. And this might be a bit tricky for you. So would you feel confident talking about surgical options to your patients? So a yes or a no to that one, please. While you guys out there are thinking about that one, I'd like to switch the question around for you a bit, Nicola, because we talked about your challenges and what you found difficult. But now I want you to tell us about what you think is your greatest achievement.
Can I say a few, like?
Yes, of course you can. Go
on. Because it's just, I think when you do lots of different things and you end up having these hurdles along the way, there is still that reward and that still big yay that you feel inside when you have passed certain things, you know, like getting through the MSc, getting through IP. But you know what, actually the greatest achievement is probably, and I mean this in the least sort of big sound of way, but actually getting to where I am now, looking back at where I was, and honestly that wouldn't have happened without help from, you know, those who actually gave me a chance. And, you know, that's anyone that I've met, honestly, like along the way, people who have listened to me, people who have actually given me the time of day to teach me, you know, to support me when, and that goes for anyone, I'm sure, especially any students. And we're all, every day's a learning day for any one of us. The moment that someone actually takes, you know, an interest back and to actually give you that time and nurture, you know, your interest, is the time that you then get to progress a bit more. And I'm sure those who are listening will know who they are when I say, honestly, thank you to the ones that have given me the chance and the time of day to get where I am.
Do you know, that's really so sweet of you, because what you've done is you've switched your own achievement round to saying thank you to everybody who's helped you along the way. So I want you to take ownership of your achievement. You've done some pretty amazing things. I mean, passing IP, getting IP, that's independent prescribing, for those of you who aren't aware of the jargon. So independent prescribing is a massive piece of work to do. It's a massive hurdle, and as podiatrists, we have to have an extremely high pass rate, much higher than physios or nurses. Physios or nurses, to get their independent prescribing. Our pass rate is set much higher. So the fact that you've done that, I applaud you, Nicola.
Thank you.
So back to some questions. So I asked you about, my last question was whether you felt confident talking about surgical options with your patients. And my last question to those of you listening in is, looking forward, if we're going to do some more of these chat shows and a little bit more educational content, would you be interested in some discussions around particular pathologies and surgical procedures to go with pathologies? Because I was kind of thinking that's where we could go to. So the question, sorry, I've waffled a little bit there. Would you like some talks about pathology and surgical procedures? Yes or no? In a nutshell.
I mean, happy to say that. Yeah.
So my last question to you this evening, Nicola, before I hand the microphone over to you and you can quiz me, is where do you see yourself in 5 or 6 years' time?
Okay. I would like to definitely achieve by then, finish off my surgical training, and actually be aiming to go for, I don't know whether this is too soon to say, because I try to sort of aim high, because I think if I can aim high, then,
you won't get there. Come on,
that's it. So I'm going to aim to be ready enough for thinking about or trying for consultancy at that stage. I really want to go for it. The moment that I get a surgical training post, I really want to go for it. work, sister. So yeah, I think I would like to be a successful pod surgeon by that stage. Also would like to have perhaps published, that's 5 or 6 years time. Yeah, at least publish maybe. I'm going to aim high again, about 10 publications, because currently on, so yeah, undertaking one at the moment as well. I think we've written now 4, I say 3 or 4. So this would be the 4th or 5th one. So yeah, in about 5 or 6 years' time, I'd like to have at least had a milestone and say 10, because I do think there's a big thing, a bit of a gap in the research market for podiatry. So I would really kind of hope that, I guess as well, yeah, more people could get a bit more confident in undertaking research and stuff as well. So that would be kind of cool, and also participating in, doing something a little bit more. For example, like, I don't know, this is going to sound really overambitious, but writing a book and like a guide or something like that. Because, you think about orthopedics and how many books are out there for orthopedics, and, the medics, they've got everything that they could possibly need under the sun. Podiatrics, you know what? Go to a medical library and pick up some orthopedic books and you'll find everything there. It's like, so, it'd be kind of nice if there were more podiatric books specifically. So if I could participate in something like a guide to, I don't know, surgical pathway-ish kind of, I don't know. I say that very lightly because, yeah, I don't know. It's a long shot.
So, I mean, it is absolutely brilliant to hear that you are so keen to write and publish and all those things. And if that's where your strengths are, then it's really great that you follow that. I have to hold my hand on my heart and say, I don't mind reviewing papers, but the idea of writing papers is kind of, it's not my forte. But there is scope and room for people with different skills and knowledge to work in different ways within our profession. And I think that's one of the amazing things about podiatry, whatever speciality that you choose to work in, that there's so much scope for people to carve out a career which suits them and suits their skills as well, but also so that it gives people an opportunity to develop into things as well. So, when you graduate, when you think how far you've come from when you were a new graduate to where you are now, and then project that on 10 years or so as well, it's exciting, isn't it? Exciting. There's so much scope out there for you.
I've just seen a question from Gemma T that's come up. It said, Nicola, did you take a break from your undergrad before embarking in your surgery pathway? No. The short answer to that. No. I literally, in fairness, from just before undergrad, so actually that's, how I thought to get into podiatry. I had a little accident and I saw a podiatrist, or my mum's podiatrist actually, and I only found out about podiatric surgery that way, and just for some reason had my heart set on that since. And I think that's actually a point to go back on for anyone out there, no matter whether you're pod surgery, diabetes, rheumatology. You think about the amount of umbrella that podiatry has to offer as a single scope of profession. How many things are out there? Can we actually say we've got enough rheumatological podiatrists, podopediatric podiatrists out there? We've got quite a lot of MSK, we've got quite a lot of diabetes and stuff. That's great. and surgery. But I think if you've got an interest in something, and the best way to do that would really be spending time in different units, even self-organized, is what I was saying earlier. Find your interest and pester people more. Go and see these things. You know, it will work in your benefit in the long run. You know, and yeah, I think that really. But yeah, I didn't take a break at all. I literally went from school, from sixth form, straight into uni, straight into MSc, straight into IP, straight into passport, straight into yeah. So it's just, yep.
Driven, aren't you? You're completely driven.
I don't want it so bad. Yeah.
Okay, so I'm just looking at some of the results which are coming in from the questions that we've asked, and it's really interesting that in these results, nearly 80% of you have met a pediatric surgeon, which is fantastic. That might be because you're already working in units, or you've had work experience there, or because you're already graduates. And there may be some master's students on listening in tonight. So I'm quite surprised about that, but that's brilliant. And we've had a really high score for those people who think that pediatric surgery is beneficial, which is fantastic, because obviously somebody has been singing the right tune for us. And I'm also interested to see that how you would like to go in the future, that 100% of you want some pathology presentations, pathology and surgical options. So thank you so much. Sorry, 100% of people want us to do some pathology and procedure podcasts. So thank you to all of you who have contributed to that, because that's given us a really good steer to what you would like to see. And we will work on that. We will deliver, won't we, Nicola?
How exciting. Yeah, no, that's great.
We're going to deliver. Now we know what you want, we'll deliver. Okay. So I think it's your turn, Nicola, isn't it?
Okay, so right. So Claire, I've got a few questions for you. It's my chance to interview you. I'm going to start with a big one, actually. Why podiatry? Everyone gets asked this, so I'm going to ask it to you.
I know, because people say, why would you choose feet? And I always think, well, I wouldn't choose mouths. Yeah.
I would say something else, actually, but yeah.
Okay. So it's actually, I've got a great story behind this, because I didn't choose podiatry. Podiatry chose me. And I firmly believe this, because actually podiatry was a second career for me. I left school with A levels in arts, and I went and worked for a bank, and then I got married and I had a child, and my beautiful baby walked at 10 months, precocious child. And when she started walking, I realized that one of her toes didn't touch the ground. I said, oh my God, my child is not perfect. And so anyway, my health visitor said, well, you know, go and see the podiatry department and see what they think about it. And I was living in Brighton at the time, and I went down and saw one of the lovely musculoskeletal podiatrists who still works in the Brighton Trust. And he explained to, and he watched her walking, did a gait analysis, and he explained to me that he had muscle balance worked and locomotion, all the rest of it. And I was just knocked sideways, because I thought, oh my goodness, I completely understand this. I had danced as a child, teenager. I'd done massive of dancing. So when somebody explained to me about biomechanics and muscle movement and function, I completely understood it. And I was just absolutely knocked sideways that this was something you could work at. You can earn a living doing this. So I then applied to Brighton University and said, you know, any chance I could come and do this degree? And they said, no chance, because you don't have any science A levels. So I thought, oh, right, okay. So I went and did an A level in human biology at night school. And then I went on and did my degree, and I loved it. I absolutely loved it so much that I just thought, I'm a student for life. That's it. I am going to keep studying. Every day's a school day for me. And It's just been one thing after the other. And this is how I end up. That's why I chose podiatry.
That's yeah. So I love hearing people's stories like that, because we get asked that all the time, don't we? Why podiatry and stuff? But everyone has such a different different stories. So it's really nice to hear that yours came from, you know, quite actually a home environment setting, really, didn't it? So, you know,
absolutely.
So in all these sort of years of your experience, then, would you consider yourself an expert?
Well,
I'm not too bold to ask. I'm just going to ask it anyway.
No, it's just like, you know, what do we mean by an expert? And I find that quite a difficult concept, isn't it? Because I guess in my nature, I'm quite humble, and I always think that people know more than I do, or better than I am, and all the rest of it. And it's really interesting because I was listening to a podcast the other day of two doctors who are tutors, and they were talking about women in particular in surgery and the idea of imposter syndrome. And they were saying, you know, lots of people say, oh, it's imposter syndrome because we always think people are better than us and all the rest of it. And they were saying, well, you know what? Imposter syndrome does not exist. It's lack of confidence. So this question about are you an expert is actually links back to this sort of CPD that I was doing about and listening to sort of other professions as well. And what it made me think about is the fact that actually there is so much that I know, but the thing is, when you know it, you forget what it's like not to know it. So does that make you an expert because you know more than other people? I don't know. But what I do know is that I've been asked to lecture many times. You know, I've lectured nationally and internationally. I've lectured at undergraduates. I lecture on several of the master's programs and all the rest of it. And when I look back at my portfolio of lectures and presentations that I've done to GPs and, you know, the first contact practitioners and all those things, I thought, actually, probably am an expert. But I always doubt my position a little bit as well, but that's no bad thing, because then you can reflect on how you can improve all the time. So that was a really waffly answer, wasn't it?
No, I think that was a really good answer, actually, because you've always been very humble ever since I've known you, Claire. You've been one of those that have such an amount of knowledge to give, but you know, yeah, you just always...
Do you know what, I liken it to you know, being an expert parent. I was in this position where I had two children very early on with my first marriage, and then I had another child, my third child, 10 years later. And you know, having a gap of 10 years between my children, people would look at me like, oh, you know, you're an experienced mother. You know, you've been there, you've done this before. You must be an expert in what you do. But I was just like, I have no idea with this child. She's completely different to the others. You know, I am no expert. Just because I've been there and I've done it before doesn't make me an expert. But what it does do is it means that I've got more ideas about how to put things together and how to manage things. So in my view, maybe that is the definition of an expert. It's somebody who has some knowledge and different ways of managing things and different ways of approaching problems. Not that she's a problem, but you know.
Well, Rob Menzies has just put check out expertscape.com. I'm definitely not going to click that now because I probably want to just stay on it and read it, but that'll be interesting to see in a moment. So Rob, if you've got that on the comments thing, then that'll be great, because I could probably have a look at that. We should have a look at that later. Rob actually also posted, I think it would be good if we could actually integrate the IP and theoretical aspects of surgery into the undergrad. Then this would be beneficial in the long run. In the long run, especially if you want to subspecialize, for example, into limb salvage instead of the current double masters. And actually that leads quite nicely into another question by Diane Rogerson Gray. Says, hello, first year student podiatrist here. Just out of curiosity, how long does it take to become a podiatric surgeon? Is one ever too old? I'm 34 in brackets, lol. Thanks.
You're never too old. I have suffered that question myself when people have said to me, you know, why are you doing this? You know, don't you think you're too old? But no, you're not too old. Absolutely not. You're young. in my view. And I am going to talk towards the end of this presentation today. I'm going to talk to you about the pathway to podiatric surgery, and it will be there on the recording as well, so you can go back and look at it if you want to, but we'll cover that. As for integrating things into the undergraduate programme, that is a phenomenal idea. And if anybody wants to invite me to come and lecture on any of their undergraduate courses, then I'd be very happy to do that. However, the undergraduate course is already very full, isn't it? So I think the argument has been that if you want to integrate those modules into the undergraduate programme, it would turn into a 4-year programme. And I don't think that the universities in the UK want to push it to that at the moment. But, you know, I'm always up for challenge if people want to come and listen to me talk.
Damn straight. Okay, this is going to be a bit of a question sort of from a different tangent here. What did you actually do during lockdown? Because I know that many different units and stuff got shut down, especially for the pod surgery departments as well, and elective surgeries. So what did you actually do, if you don't mind me asking?
No, I don't mind you asking. You know, we've all been affected by the last 2 years of COVID and disruption to our lives and all of those things which happened. And I think it's a very relevant topic to reflect over, you know, how we manage ourselves professionally, and the wider narrative about what was going on. And when we went into lockdown, which was March last year, I had a couple of clinics already booked. There were things like sort of post-op patients that I had to go and see. So we had to run some clinics, even though we were at that point saying we're not doing any more surgery and we're closing down the unit and whatever. And what actually happened was the company that I work for and do my NHS contract with closed down completely. We did no elective surgery for 4 months. And during that time, as soon as we were we were closed down, my line manager tried to place all of her staff in appropriate roles, and that was fairly easy for the nursing staff because you know, the local hospital just sort of swept them up and said,
they're so diverse in their skill set as well, aren't they? So
the problem was with me is or with podiatric surgery is we kind of didn't fit into any of the round holes, you know, because we're a square peg. And you know, our skill set is such that we have advanced skills, but we don't kind of fit, we didn't fit anywhere. Now, I know that lots of my colleagues were integrated into sort of high-risk units, or, you know, one of my colleagues was actually going out and doing IV meds for people having chemotherapy because he's an independent prescriber and he could do that. So, you know, lots of pediatric surgeons were put into very challenging positions, but because they couldn't place me anywhere, and I think it just became a bit of a problem, really. I was furloughed. So for 4 months, I had a rest. I learned how to make sourdough. I planted tomatoes. I went out for 2-hour walks every day. And I stayed locked at home with my husband, who was working at home, and my youngest daughter, who was sent home from university to continue with her studies online. And I just did, well, I say just did that. I did that for 4 months with this sort of kind of like, when's it going to change? What's going to happen? When's it going to change? But what I did do as well, because I didn't want to sort of vegetate, I didn't want to become one of my tomatoes that I was growing, I did absolutely masses and masses of CPD. So I took the opportunity, and I've always been incredibly lucky that when I need time kind of comes to me. So at the time, all podiatric surgeons were having to do an annotation program, which was run by Huddersfield University, and it was necessary for all surgeons who already had their fellowship to do this annotation certificate, so that we could then have the annotation put on the HCPC. And we were all under a deadline to do this. And it was an enormous piece of work. I mean, you know, if you think how much work you did for your masters, I think it was probably something along those lines that we had to do for these annotation documents. So I spent the time doing that, and so I was able to really kind of concentrate on doing that. But on top of that, I did webinars, and I listened into all sorts of things that I wouldn't have thought of listening into. And I also did some creative stuff. I did a creative course on Instagram and marketing, and, you know, just kind of to feed both sides of my brain a little bit. So I really feel that, you know, that time was almost a gift to me. It came when I needed to do it. And then when we came out of lockdown, my company only took me back for part of my contract because we didn't have enough work coming in, because it was all kind of clogged up somewhere. So at that time, my local trust, which is Brighton, they put out an advert saying, if there are any podiatrists out there who have any spare clinical time, please, can you come and do some clinics for us? So I phoned up the manager down in Brighton, and I said, well, you know what, I'm furloughed one day a week. Do you want me to come and do some clinics? And there was this kind of like silence on the line. And she said, but you're a consultant. I said, yeah, but I'm a podiatrist. So do you want to use me? So I spent about 5 months working one day a week for the Brighton Trust, just doing doing general clinics and, you know, seeing their new patients and all that kind of thing. So it was really useful for me to be able to give back as well. So I enjoyed it, really enjoyed it.
That's really nice to hear.
Yeah.
So, I've got a few more questions for you, Claire, if you don't mind.
Yeah, you know me, I can talk for Britain.
No, that's okay. And I know that this one, and I'd been a bit like, to ask this one, because it's a bit it's one of those questions whereby I'm sure a lot of people will have mixed views on. So I'm just wondering on yours. What do you make of social media?
So I'm pre-IT era originally. You know, when I did my undergraduate degree, I had to go out and buy an Apple Macintosh. I hadn't worked a computer before. It was, well, not a PC anyway. You know, I've had to come a long way to adapting my skills to using lots of different IT, and, you know, lots of it I've learned from my kids who've had to teach me. They say that I have a particular tone in my voice when I shout down the stairs, I need help. They said, you broke the computer again, haven't you, Mum? So I've learned most of it from my kids. But one of the things I did try to do while I was furloughed is to up my skills a little bit. So yes, I do have an Instagram account. It's not quite as beautiful and creative as I kind of wanted it to be to start off with, but I try and put a post on there fairly regularly, and a lot of it is sort of my own sort of dry humor about things. I post lots of pictures of the gifts that I'm given. And then I put a few educational things on there as well. Like if I've seen something interesting in clinic, I'll put it on there too. So I saw one of my patients had a ruptured Achilles that I did not scan on, what was that, yesterday. So I might end up putting some of his pictures on the Instagram account. You know, I do have a website for my private practice, and it's linked to Facebook and all that kind of thing. But, you know, I am absolutely not an expert on social media, and I think you have to be very, very careful about what you post there. You know, try and keep it professional all the time. You know, there's nothing wrong with showing the person you are, as long as you're not showing too much of your person. Just being aware of sort of social niceties.
See, this is a thing, isn't it? Because I see many people from all different aspects of podiatry, or even any other profession as well. So we see, namely, you know, some consultants who will put up like amazing, you know, pieces of work that they've done, and also really educational stuff as well. Actually, you know, the power of you know, online is really useful, I think. It can also be, as we all know, very detrimental to a lot of things, and especially, as what you say, rightfully so, we have to be so careful with what we put, GDPR, everything like that, but for the things that do go up, with, of course, informed consent, is really useful for, especially for students and people that are learning, as I say before, and I'll say it again, every day is a school day. We're always learning new things. But I even see, things go up on our own platform, on our Facebook, say UK Podiatry, for example, and some of these things are actually really educational. So I do think there's pros and cons to both. And I think also much like with changing times, there's more and more people that are going on to and using social media as a form of marketing and networking, people in private practice, podiatrists in private practice, or those also in the NHS. I do think it's a good thing if used wisely.
So we know that there's some new things coming online soon, and Michael, who's been running these Podiatry Live webinars, is starting up something new which is coming soon, and I think he's going to run you a little advert for it.
Show reel. Okay. So, I mean, I did have a couple of questions extra, Claire, but I know that there was also some questions that we were sort of thinking of going back to for some people that are in the audience that I put up a couple of questions. So do you mind if perhaps I ask maybe one more?
Yeah, that's fine.
I think that's kind of maybe relevant to a lot of people out there. But if you were to give any tips, like what would be your top tips for any new podiatrists out there?
Okay, so I know that when you graduate and you come out, you've got this kind of like, there's two sides of you. There's one of you like, yeah, I've got a degree, I'm so clever, I know it all, and I'm going to go out there and make everybody better. And then you've got that other side to you, like, oh, they know so much more than me, they've got 10 years, 20 years experience, and who am I, and all the rest of it. So I think my top tips for people who are sort of starting out in their podiatry career are, firstly, learn to listen, because you learn so much by listening that you can take away and use yourself. And although it's really good to engage in conversation and to ask questions, you learn so much by listening. And it's not just about learning, but you get more joy out of your patients as well. I mean, I could write a book on the stories that I've heard from patients. And then, it all links into their health and their general health and their social health and their medical health and all those things as well. But listening, learn to listen. That's a really, really important skill. And then I think another top tip is to never lose sight of what are your important values, your own personal important values. So for me, I have 3 values which I don't rank them. One is more important than the other, but my 3 important values are nutrition and exercise. That's for myself. I'm really interested in the food that I eat, the quality of the food, where it's come from, and all of those things, because nobody performs well unless they're well nourished, and nobody performs well unless they move. And movement is so important to me personally, and it's what I preach to all of my patients as well. So nutrition and exercise is one of my top values. And then my family, because family is everything, isn't it? Whether that's just your own nuclear family or extended family, whatever. Never lose sight of the fact that your family is really, really important. And then there's my job as well. So, those are my 3 kind of important values in life. But it's getting that value, getting that balance between those things, which will give you happiness, and that's kind of so important to make you feel centered and to make you feel valued as well, is to not lose touch of your own important values. And then one of the things we talked about earlier, what you were talking about, you know, the what you'd learned and how far you've come, is that the skill of resilience. And you have to build some resilience, and I don't mean that as a sort of, you don't have to be Teflon coated so that nothing matters to you and it just kind of like bounces off or anything, but you have to learn those skills to be able to absorb things and reflect on them and then grow from what you've learned from those as well. So resilience is really important. And then I think that in fact, all of the things that I think are really important, my top tips, are really all based on professional integrity, because, you know, how you perform in your career and how you perform in your personal life as well is so visible now, isn't it? You know, nothing is hidden. And we can't hide behind, well, you know, I was drunk when I did that. You still did it. So So, you know, there are no excuses there. So your professional integrity has to sort of be reflected in everything you do. But my top tip along professional integrity is never diss other people's work. Now, what I mean by diss is it is a huge professional mistake to say, I wouldn't have done it that way. Or
you hear it though, don't you? You do hear
that should never have been done like that. Oh dear, don't do it. Just don't do it. There are very, very positive ways you can and believe you me, I get patients on a fairly regular basis who have had treatment in other places and they're not happy with the outcome. But I know there will be patients of mine who are not happy with the outcome. And they will go somewhere else. And I'm not going to thank anybody else for saying to a patient, shouldn't have been done like that. So be professional. Even if you see something that you think is terrible that has been done, and I've seen those, I have absolutely seen them, don't get wound up in criticizing other people's professional work. So never diss somebody else's work. Top tip. Always give back. So I think it's an important part of being a professional to give back into your community and give back into the profession. So I've done charity work at the London Marathon. I do lots of lecturing. A lot of it is unpaid. A lot of it is done in my own professional time. The more you give, the more you get. So, and that is part of being a professional as well. Everything that you do, record it for your CPD file. So tonight, Nicola and I will be putting down 1 hour of presenting a webcast live, and that will go in our CPD portfolio. And that is really important because at some point, the HCPC may call on you to produce your portfolio and your evidence to say that what you've done. And you need to have a wide scope of things that you've done, not just sitting reading papers or whatever, but you have to show that you've used your skills in many ways. So record everything that you do, put it down in your CPD file. I talked to you earlier about your achievements. Own your achievements and be proud. Okay? Be proud of how far you have come and own those achievements.
Okay.
And never forget that learning is for life. Okay, you don't come out of university and know it all. No, day that I know it all, the day that I stop learning, I'm going to retire because there's no point. You know, every day is a learning day. So if you have that approach to things, you will always keep learning and you'll keep excited about your career as well. And then my last top tip is be the best you can be.
Yep, absolutely agree with that.
So you can apply that to many different professions, but I think in our profession it shows through so much, those people who have a really positive attitude. But don't let your work be detrimental to yourself or your health or your person or whatever, anything like that. You have to love what you do.
Absolutely. Thank you so much, Claire. That's honestly, it's such like, and you do it so humbly as well. You're such an eloquent way of putting things across.
Oh, thank you. Thank you, my fan club. So I think we have got about 15 minutes left, haven't we? So we're going to talk very briefly about specialist roles in podiatry, and I'm going to talk briefly about surgical training. So over to you, Nicola.
Okay, so specialist roles. There are, I mean, if this is what we were talking about before, Claire, that there are many different types of specialist roles out there. I'm sure any one of you listening, you all have your own specialism. But I think there is such a range of, like as what I was saying earlier, such an umbrella of different facets of podiatry alone. But I kind of think, because I could think off the top of my head, only because, I know them personally as well, of people that are, very good at what they do in terms of their specialty. So we've got our podopediatrics, our rheumatological pediatrics, MSK, diabetes, surgery, so on, dermatology even. Vascular. There we go. See, this is the thing. How many of you, actually asking out there, how many of you could put a list of all the specialties of podiatry that you know of? Like how many specialisms do we have?
So when I graduated, it was diabetes, biomechanics, or management.
Wow.
That was about it.
Wow.
And pediatric surgery.
Yeah. Because I remember in undergrad, so obviously we had like our little facets of different things and like our OSCEs and stuff, and we had, diabetes, neurovascular, MSK, dermatology, and pharmacology as well. And there were tiny little hubs of different things. And I think that's gradually increasing more and more. But much to even looking at MSc level, you see Rob Menzies, you put lots. Please list them. Let's go, gang. If you're out there and you're listening and you have a specialism, put it in there. Get yourself known. But yeah, this is the thing. I just wonder, do we actually have enough different branches of MSc modules or educational? We've got so many developing and so many big things coming up. We've even got, say, that the skin surgery for podiatrists module, module set that we've got, big thing coming. But do we have enough CPD and education out there for really creating the foundations of what makes a specialist in said departments? Do we have enough rheumatology modules? Do we have enough dermatology modules? All of these things. Because when I was in MSc, we had, say, MSc for podiatric surgery that encompassed all these different little facets of and little, like I think there were 7 modules in total of different things. But do we have enough? Do we have enough? Is there enough recognition for those out there in their own speciality for other people, general world of pods, to go and say, oh, I don't know enough about that specialism, say podopediatrics, but I know who to refer to? Or I don't know enough about.
I see what you mean. Yeah, who to refer to. I mean, there's masses and masses of training modules out there to do. It's everything from sports medicine through to diabetes modules, and there's absolute masses. If you've got a will to study, you can choose all sorts of things. And I think if you're working within the NHS, you can develop roles. Certainly, if you show an interest in doing something, you can develop roles. And if you have a good manager or a good leader, they will lead you to develop your skill set in the area that you have an interest in. I think it's possibly more difficult in private practice, where you have to be a general practitioner anyway, don't you? Because you have to see whatever comes through the door, don't you?
Interesting. Oh, sorry. I was just going to say, interesting that you say about developing roles and things, because I only know of one, and please forgive me if anyone's listening and you know of many more, but personally I only know of one, that actually spent time voluntarily in an A&E unit, and ended up actually having a role developed for them as a podiatrist working in A&E in actually a very, very busy London-centric hospital. And I find that absolutely incredible, because I've not known anything like that before. And to think the amount of experience that you could get in A&E, you know, trauma, all of these different types of things. And, you know, thinking that we want to be a little bit more like our medical colleagues, what a place to be to do it, you know. But just throwing that out there.
So be bold, go out there and do what you want to do, is what you're saying.
Yeah.
So just to kind of finish off today's presentation, we're going to talk a little bit about the surgical training and the surgical pathway, because I've said there's loads of training out there for you to do. So Mike, could you put up the training route for me? That's good. I'm hoping that you can all see that. So there is a career pathway for pediatric surgery, and do you know what, that is so small I can't see it. Oh, let's see if I can make it bigger.
If I squint.
Oh yeah. So these slides will be made available to you so that you can have a look at these. But what I would recommend for anybody who's interested in pediatric surgery is when you graduate, you do need some general practice experience. So obviously you have to be a registered podiatrist, and as you're progressing, you can do your MSc in the theory of pediatric surgery. But I would recommend that you get some experience in a surgical unit, whether you're working there as a sort of staff pod, as you do your academic studies as well, and climbing up this ladder. So where are you on this ladder now, Nicola?
So let's have a look. So I'm advanced podiatrist, so staff pod. At the moment, and I'm currently, so I'm just having a look at that ladder. So sorry if you all see, like, you know, shiny bits of my forehead, but I think I'm waiting for a trainee role. So I don't know if that's actually on there. Advanced, trainee in podiatric surgery, so midway.
So you're midway. So you're climbing that ladder, but you know, it is a bit of a steep ladder. I think we all appreciate that, but there are academic qualifications as you climb the ladder to go alongside the theoretical training that you're doing. So could we have the other slide up as well, please, Mike? Here we go. So this was written by the Dean of the Faculty of Pediatric Surgery with assistance from her board. So this is looking at the training route. And really the starting time that you need to think about is getting your you need to start as a podiatrist. So you need your bachelor's degree first, and then you need some time in clinical practice. Then you need to get your master's, and then you're progressing on to getting some placements, and then you're getting you have to get a we used to call it the passport. They're calling it OPES now, aren't they? I can't remember what OPES stands for.
Oh, sorry, let me just turn.
So it's an assessment that you do with a consultant pediatric surgeon to just show that you've got the right trainability, really, and that you've got some knowledge behind you before moving on into a surgical training post. And there are this nice purple number 7 is the NHS training posts, which are advertised through the NHS websites. Then you're given a training number, so it's all registered at the college, and then you do 2, 3, maybe 4 years of training, depending whether it's part-time, full-time, or whatever. And then to get your fellowship, you have to sit a practical exam where you run a theatre session, which is observed by 2 examiners. And then you can become a fellow. And then once you're a fellow, you have to do 3 years as a registrar. I think that might have been reduced actually to 2 years now. So as a registrar, you're working alongside a consultant so that you have somebody who's a more senior grade to you who can supervise you and allow you to develop your skills until you're a safe and independent practitioner. And then once you've finished that, you can get your certificate of completion of pediatric surgery, which is known as the CCPST. And then you're available to apply for consultant posts. So, some people will whiz through this route really quickly, and some people will take the slow train, which is what I did. But what I do want to say is because you can almost design your route through this, and take the time that you want to, because a lot of us are, I was working as a general podiatrist some days a week, and then as a surgical trainee on other days of the week, because most of us need to earn a living as well. Is that it is very flexible and it's very available. So when people say, "Oh, I can't do that because I've got children," well, you know what? I did it with 3 children, and so if I can do it, anybody can do it. It's there for you. If you want to do it, you'll make a way of it happening for you. So, I mean, it might look like it's sort of long and arduous, but if you don't enjoy the journey, you're not going to arrive. You're not going to enjoy arriving either. So you have to be in a position where you're going to really engage and enjoy yourself along the way. So that's my top tip on this point, is that the journey is important.
Absolutely is, and learning along the way and absorbing all of it. I think that's. There's another thing on the screen. Is that?
Look at this nice lad, and we've got a gold star at the top when you become an HCPC registered and annotated. So I've got my gold star. It's not quite an Olympic medal, but it does feel like it.
In between the ones underneath that is probably just little biscuit points that you get along the way. Get to have a brownie.
Okay, so Mike, if you want to take that down for us, perhaps what I will do is I'll just open this up and say, if anybody has any questions at this point, I'd be happy, and Nicola will also be happy to answer them. And if you have any requests for future podcasts, please put them in there as well, so that Nicola and I can work on what we're going to present to you next time. So, is anything coming through for us? Or is everybody falling asleep now?
If I had a little poddy stick, could
you got a little poddy stick?
Wake people up. But yeah, I think I second that, Claire, actually. So furthering to this, once we go, I'm more than happy for anyone to come in touch again. I don't have the abundant amount of experiences like the consultants or the registrars do. I could probably point you in the right direction of some people that I might be aware of that have the answers. More than happy to help where I can. So yeah,
somebody's put up, will we be posting the pathways? Yes, we will. I'm not quite sure how, but they will be posted somewhere for you to be able to see them. You can always request them from the college as well. If you phone the education officer, she can send them through to you, but we'll make them available to you. Any other questions? Any other desires for podcasts? Content? I think they've all gone to sleep, Nicola.
That's okay. It's just me and you, as long crack open the wine now and
ruin my life. I'm the last person at the bar.
Party for 2. I'm not on the college website. You know what? I don't know whether they
are they on the college website. Well, good luck, mate, if you can find them, because I couldn't.
I used to be under Podiatric surgery sub-tab.
Okay. Thank you very much. You are obviously better at searching than I am, because I couldn't find them, so I asked him to send them through to me. Thank you for that. Thank you, Adam. Thanks, really Adam. Nice of you to say that. And I think that's probably the point where we need to say goodnight to everybody, and we'll be back, won't we?
We shall be back. Cheers, everyone.
Good night.
Bye.